Hello. So this is about AI, and we'll give some examples on nursing activity understanding, support for elderly people in the hospital, for example, anything for the blind people. So few examples. So we always sell it to the real life heroes like nurses and doctors and others. Uh, and sports activities to understand whether the person is running properly or not. So if we have more AI-based systems, that would be wonderful. Now, not care activity is very important to understand them, and elderly people, blind people, so sports activities, for example, running and so on. So some few examples are here. So there are different competitions at UBComp and ABC so far, and we participated. So the data set is developed in Japan. Now, this is one data set. So they have 49 participants, 48 days, they collected data in Japan of different nurse activities like helping in mobility, assistance in transferring, position change. So you see the different activities they do. But when they do and in the lab environment versus in the field means hospital or care centers, then it's different. Okay. And the data are different because real life is difficult. Similarly, real life data is difficult because we have lots of challenges. This is very important one to understand that. You see that, say, I am the nurse number 8. So I did some activities, this one or my middle one, much more, and some other activities I never did. This is nurse number 2. So for example, it's you. So and you did some activities, but in some cases you never tried anything. Okay, or you didn't have the option to do. Okay, this is nurse 3, 4, 5, and so on. So if you have different kinds of nurses, they do different things, and we know that in hospitals or anywhere, some activities are so frequent, some activities are less frequent. How to handle these kind of things? So huge class imbalance problem in AI and in data collection. Class imbalance problem means like some classes you have lots of data, some classes you have much less data. So you cannot make a smart method when you have a huge class imbalance issue unless you develop some good quality methods based on math and statistics, and AI can be improved in that regard. It's not easy. Missing data is another point that I mean, sometimes data is not coming. Like when you are walking and your sensor is not collecting data, so probably there is a missing data. Some activities are having very short duration. Some activities are very longer duration. So these kind of problems are real problem. In data collection and AI development and so on. Human error is another point that if, I mean, as a nurse, my first duty to serve the patient, not to give you data. So in the mobile phone that I'm doing this one or that one, okay? So forgetting to stop recording an activity, even if it is finished. So if I forget, then you cannot get it on the phone. So or mobile phone or ground truth will be different. Okay, so that's very important. So we did very well. Like once we become first, got 0.1 million Japanese yen, second another year, and third. But still, the results are extremely poor because it's a very much challenging area, and we must need much more work. Uh, in last year challenge, we also participated, but we got nothing because this is also real life. Real life data is difficult. Real life you cannot win always, and that's the point. Another important work, what we have started, but we could not finish, that monitoring while running to understand the wellness, the risk, and the conditions of people. How to run correctly, for example. This is somebody can say, and if I'm a professional athlete, then what will happen that some experts will be behind me or next to me and will help. If I'm under rehabilitation after an accident, somebody will help me because I'm a rich person or I'm a rich athlete. But what about millions and billions of average people who cannot have, have this kind of opportunities or scope? So if you run after some problem or health problem, or after some accident or stroke, then probably you are doing something which is actually harming your body when you are at home. So can we have some kind of system, for example, on a treadmill? with the collaborations with hospitals and these kind of treadmill companies. If you put different sensors or cameras and understand the balance of the persons and running conditions and the footsteps and other things, and based on this you can give not only how many steps or how many kilometers I ran, okay, so but yeah, I mean your health conditions and so on. So these are important. Using AI we can do. Elderly persons activity in healthcare facility can be done using AI. So different kinds of sensors and their activities can be checked. Elderly person monitoring when they're at home. Now, this is also extremely important. Okay, so smart home system for elderly people and monitoring in-room activities we need to develop. Unfortunately, I could not do it for my mom, but we need to do so that somebody, I mean, when they're alone and in trouble suddenly, like a stroke or some kind of problems, or fall down, then we can automatically quickly detect and monitor and call the ambulance or family members and others, okay, before they die and so on. So, so we need to design, set up, and do demonstration. Pilot design can be installed in-house patient or person or subject. Data collection with elderly subject is necessary, and we can use cameras, but again, RGB is a privacy issue, so people can say, but as RGB gives lots of good information, we can make a system that, okay, we'll not store the RGB, but we process the data and keep the processed data so that we can use those things to understand something later on. Depth cameras, this is another point. Skeleton is unable, I mean, you cannot use the skeleton data when someone is sleeping, because if your body is covered with a blanket, then you cannot or we cannot get the things. So while on a bed covered with a blanket, skeleton data is difficult to get. So this is important area. Contactless human activity recognition is not only the video. What are the things? Because some elderly people or patient may not like wearables, like to wear IoT sensors or smartwatch or something. So even if when I sleep, I don't like to take my, I mean, sleep monitoring device, which is I have one from Apple, one from Garmin, and I had another one from Xiaomi or something, and I don't use any of those because sometimes when I sleep and then movement and then it gives a discomfort. Elderly people may not like it more because probably it's harming and giving pain. So this is a point, but without data, we cannot have our AI system to grow. So, and some applications, we may need radar or Wi-Fi or anything else. So these are the point we need to check. If you are interested in this field, you can read one of my books. It's on Springer or contactless human activity analysis. Fall detection is extremely important, very, very important for elderly people at home or hospital, people having dementia, Parkinson's disease. It's a big challenge. If I have Parkinson's disease or dementia and I try to stand up, but I don't know where to sit, or maybe the balance is not good, then I'll be in big trouble. So these kind of things, we need data set, but real videos or real sensor, that's a problem, because I cannot push my elderly friend or elderly parents to give me data. How to do these kind of things and make it more realistic? It's one. Some of my students for the first paper we did on fall detection, they use the smartphones in real time and they had pain, not realistic, and so on. So, and another point is that if I fall down, then the system can detect, which is not ideal in one sense, because can we predict before I fall down? This is much better. Okay, so for example, if I have sensors on body, or if you collect different kinds of data from the body, if you understand that I am under stress and having problem, and then I didn't have good sleep, and considering my normal blood pressure and heart rate variability, heart rate, skin conductance, this kind of information, and the past or the regular one, how much the variations and how to do this kind of things can be done. It's extremely difficult, but if we can develop some kind of smart systems so that we can identify or predict, then we can help people and save money as well. We can do using wearable device as well. So normally we have, two ears, most likely. Okay, and then we use different kinds of Bluetooth devices. Those Bluetooth devices, we have what? We have definitely, Bluetooth, and we have, for example, microphone and speakers. But what about if we put some kind of sensors, IMU sensors, and then those IMU sensors, this is from Nokia Bell Labs for our work. So if we can collect and using a mobile app and then put the data to the server and do some kind of processing to understand human activity or behavior or eating habit disorder or swallowing problem or socialization through speaking communication, if you have any health related things. So these kind of activities can be done. But again, can we use this kind of inside air, this kind of airable devices to understand emotions, stress, psychology? Let's look at the blind people. So can we use AI? So you see that AI can be considered in many, many ways with hardware and software together for different applications. So if we have blind people, and obstacle avoidance, like distance between the user and the obstacle, is measured by camera and sensors, for example. And if you can integrate reading assistants like image to text converter, these are done already in many cases. And followed by auditory feedback like text to speech. These are also done. So using different methods, if we can do these kind of things and improve a system, that would be wonderful for the blind people. But problem is that AI for the blind, not mentally being blind. Many people are mentally blind, unfortunately. Okay, maybe me, partially, I'm not sure. So enhancing accessibility and independence. This is extremely important, like AI for the blind. What are the areas? Think, don't remain blind on AI. Okay, but we need to know. For example, navigation assistance, how AI powered navigation apps. For example, Blind Square is one which is available, or Lazarillo. They can help the blind people easily, but we need much more and sophisticated things. You can Google and get the information. Don't remain blind for AI. For example, another example, like optical character recognition, OCR. We know it, right? How AI can convert printed text into speech or braille, making books and documents accessible so easily. If we can do it and produce for the millions of people, that would be super wonderful. Think about object recognition, AI-powered apps that identify objects and people in real time, and then help the blind people to understand, as we showed that, via text and text to voice and so on. And video as voice assistance is also important, as like Siri and Google Assistant. And we need to check, because you see that even though Siri and Google Assistants are there, but because of cultural accent of different people, you call for Peter, but they are calling pizza. You are calling someone, it's giving someone else, and you are getting angry and just smash your brand new, smartphone or Apple, and then you are crying because you just broke your 15,000, 15,000? No, 1,500. It's too expensive. $1,500 phone. Okay. By the way, my phone is probably 15 only. Web accessibility, how AI can improve web accessibility through screen readers and text-to-speech technologies. So many things can be done based on AI. Think about this, that if you know anyone is blind, or think you are blind now. So forget, not you. Say, I am blind now. I now close my eyes. Sometimes I close my eyes when I prepare lecture, something because I don't need to see, so I can give rest on my eyes. Now I'm blind, and some accident I become fully blind. Then think the life. I can't see the beauty of the world. I cannot read. I have many books, but I can't read. The website has lots of information. I can't see and read. How to help those people? If I want to move from one room to another, this is a very difficult thing. Normally, by-born blind people may have more, ability to understand because they have something. But if by accident or something, suddenly I become blind and lose the sight, then how can I manage? And lead my life. These are extremely important, especially many elderly people, they have sight problem, narrow vision and others. Okay. So if we can use AI, that's very important. But there are lots of challenges and ethical considerations. These are very important. Always study and recall these kind of things when we talk about AI. Address challenges and limitations of AI for the blind. This is important. Need for training data and privacy concern. Ethical considerations regarding AI bias and fairness, potential misuse of data, or even AI systems. Hence, we need to help. We need to volunteer. We need to find where we can collaborate with organizations who are dedicated to this cause. It can be for blind people. It can be for autism. It can be for elderly support system. It can be for Parkinson's disease or dementia. It can be for stroke patients. It can be for givers. It can be for nurse activities and others. And if you know someone, some companies, or or hospitals or carers or schools, please contact me, because I need this kind of collaboration so that I can continue my works with better data, curated data, multimodal data, and make some good methods and so on. And we need to discuss with that. Thanks a lot. All the best. Stop.